We can alleviate physical pain, but mental pain, grief, despair, depression, and dementia is less accessible to treatment. It's connected to who we are, our personality, our character, our soul, if you'd like. This quote, stated by British film director Richard Eyre, is an example of how difficult it is to treat dementia without burying the person. Therefore, there needs to be another route to help dementia patients other than by pharmaceutical means. I believe that healthcare providers and family members alike need to come together to offer different choices of substantial therapy to help alleviate the darkness of a person's soul who has dementia. Dementia is when a person begins to feel agitated and resistant due to not being able to communicate clearly, as stated by the Scandinavian Journal of Caring Sciences. It can also be characterized with loss of memory and change in behavior. Dementia has 3 stages. In the beginning, it starts as simple as repetitive communication, forgetting the placement of objects, and displaying difficulty in simple tasks such as driving. In the middle, it advances to a person forgetting social cues and having difficulty performing activities of daily living, such as brushing teeth, making breakfast, and getting dressed. In the most advanced stage of dementia, a person will need full-time care from another person because they may not be able to ambulate or eat on their own, as stated by the Family Journal of Health Practice. Many symptoms of dementia are behavioral, and medical doctors often use pharmaceutical drugs to curb these behaviors, though I believe that with therapy as our frontline approach to dementia, we can help retrain the brain and promote independence of activities of daily living in patients. The 3 most common therapies that I will be discussing are cognitive stimulation, art therapy, and music therapy. Cognitive stimulation is when a trained therapist sits down with a group of patients and implements tasks that stimulate the mind, as stated by the Journal of Nursing Older People. In the case of dementia, it could be reminiscing about the past, crossword puzzles, or word association. These are activities that encourage the brain to think deeper than what it would normally. In England, there are clubs that use cognitive stimulation to help elderly people with dementia. These clubs occur once a week as a full day, and the day starts with breakfast, has a break time for a small lunch, and ends with supper. Between these meals, different activities that revolve around cognitive stimulation are used. Testimonies that resulted from the club consist of one elderly stating that the club is the happiest thing that has ever happened to me. One even made a comment that she has not had so much fun for ages. These clubs have been vital in helping older adults with dementia gain mental independence and has improved quality of life. Art therapy is a tool used to help dementia patients express themselves and how they feel inside. This art can take form in drawing, painting, crafts, and expression, even using the body. Deciding which task to use depends on the patient himself. In Korea, there was a study done where patients with dementia were given art therapy for a period, with a test before and after to see where they ranked on a scale used for dementia. The types of art were mandala drawing, drawing taking turns, mud crafts, and expression of body parts, also collages. It was deemed that the art therapy activated the central nervous system by enabling the patient to use their hands and promoting the ego, which lessens depression brought on by dementia. Music therapy seems to be the most intriguing therapy, since music and memory are correlated. Music happens to be in everyone's lives. We hear music on the television, at baseball games, ceremonies, and even at a train station on the radio. There is no wonder that humans connect to it so deeply. In Scandinavia, there was a study done where care providers would sing while helping patients with activities of daily living. In this study, it was shown that music enabled the care providers and patients with better communication, eye contact, and interest in each other. Whereas before, at best, communication was minimal and the patient's participation was also minimal. Even in my own nursing home, we have music programs to calm agitated residents. I have seen residents be brought back from agitation at the sound of a song they once knew and loved. Sometimes music therapy works better than medication. I have seen it with my own eyes. This makes care providers, family members, and institutionalized workers alike jobs easier when their family member or patients are soothed by music. I understand that sometimes medication is important, and the pain of a patient may be so unbearable that families and physicians jump to medicine first. I would just like for us as a society and for those in healthcare to put away the drugs as a frontline defense and try therapy first. Then add the medications as minimally as needed and only to ease the pain. That way, with the time we have left with our loved ones, is not covered by the mask and darkness of medication. Wouldn't it be a joy for us to promote our family members' independence and quality of life until the very end? I believe that we should be using therapy first, then medication second for dementia patients. Medication can often mask a person's soul, while therapy will heal and reveal a person's soul. Effective therapy treatments for dementia are cognitive stimulation, art therapy, and music therapy. They are also more cost-effective than drugs. We can implement these therapies even through a volunteer-run basis. More importantly, I encourage family members to work with those in their family that suffer from dementia with these therapies, so that they may enjoy the end years of their loved ones' lives.